This is Monday, July 17, 2017. This is the Human Services Committee, and we will move to number 2. We'll be looking for approval of the agenda. Commissioner, help me out.
Yeah, second.
That's okay. Okay, we have a motion second. Any comments, questions regarding the agenda? Okay, hearing none. All those in favor, assume saying aye.
Aye.
Not same signal. Okay, we're on to number 3, public comment. Public comment out there. I see 3 wonderful ladies up front. No comments? Okay. We'll move to number 4A. That's the minutes for June 12, 2017. I'll be looking for a motion support.
Support.
Okay, we got motion support. Comments, questions, and any changes to the minutes? Okay, hearing none, all those in favor, signal saying aye.
Aye.
Not, same signal? All right, thank you very much. And we're on to, there it is. Our administrator did a great job. That just popped right up. Okay, 4B, we have the Lifeways monthly quarterly report. I just contacted their governance director. The COO is supposed to be here. She had a meeting at Henry Ford Allegiance. So I guess at this point, we'll just skip on down to number C since she's not here. And as far as number C goes, that's the Community Action Agency's quarterly report. That is on your board docs there. Hopefully you've had a chance to look at it. Toby Berry is not able to be here. If you have any, I seen her last Thursday. If you have any questions, you're more than welcome to contact her and talk to her about it. So, other than that, if the committee doesn't mind, we're going to move back up to number B, the Lifeways monthly report. And we have Shannon Clevenger from Lifeways.
Mr. Chairman, before Shannon reports, would you mind receiving the quarterly report from CAA, please?
Commissioner Tompkins, thank you. Got support? All those in favor, signal by saying aye.
Aye.
Okay, not, same signal? Thank you. Thank you, Chairman Shotwell.
Good afternoon. Sorry, I got stuck in the traffic trying to get here. All right, so I'm going to go over just some highlights from the report that you have in your packet from Mary Beth. The first thing regarding Lifeways, we have hired our Chief Financial Officer, Allison Magda. She had been serving as the interim, and she has now been named the Chief Financial Officer. Under state budget in section 298, 234 updates, there's opposition to the state's proposals to move the system towards privatization, as I'm sure some of you have heard about, as contained in the fiscal year 18 budget from the state. There are rallies, letters, people reaching out to their legislature to have conversations about their concerns or fears related to privatization of the system. So just an update on that. Media coverage of the completion of the budget, a controversial plan to test out integrating the state's physical and mental health delivery system for Medicaid patients is set to go ahead under the 2018 budget deal worked out between the House, the Senate, and Governor Snyder. There will be as many as 4 pilots in the state of Michigan over the next 3 years to test whether or not a combined system of physical health and mental health will result in lower costs for thousands of patients under this deal. The pilots that have been named so far would occur in Kent County, a rural county, and an urban county. Neither one of those two have been named yet, but Kent County was named as a pilot county for the state. The National Association of Counties outlines the relationship between counties and Medicaid. An overview of the county's role in healthcare and Medicaid. Our counties invest over $80 billion annually in community health. 75% of the U.S. population is served by county-based behavioral health systems. Our counties have always served as a safety net for those who are unable to afford care, and many of our states require counties to provide some level of health care for low-income, uninsured, or underinsured residents. Medicaid is the largest source of health care coverage in the United States. When people don't have Medicaid or any other form of insurance, counties are forced to provide uncompensated care. So it was just kind of an overview that they're looking at related to some of these pilots that are going to be happening. And that's all she has for me to share with you today.
All right, thank you, Shannon. Comments or questions for Shannon? Commissioner?
I don't understand when you say you're going to have 4 counties,
For pilots.
4 pilots to test whether there is an association between mental illness and physical illness.
Not an association. What they're planning to do is create some pilot opportunities over the next 3 years to see whether or not piloting some prescribed integrated health, so physical health and behavioral health pilots, will result in a lower cost. So if the services are integrated versus separate, do people have a better outcome and is cost of service lower? So the state is looking at some pilots to try this in some counties to see whether or not if they force the county to do integrated care, will people have better outcomes and will the cost be less? So they've named Kent County for sure as a county that there's going to be a pilot of some type in that county over the next 3 years to see whether or not there is a system that can happen that would result in integrated health, better outcomes, lower cost. They've named a rural county, but have not named the county, and an urban county.
Well, my point is that for years we've known that stress in your life, okay, and things you're not able to handle mentally, they just things come on too much, okay, is one of the main causes of chronic disease, hypertension, okay, and other things, okay, the bad habits, obesity, smoking, drugs, and so on. So we know there's a direct relationship between that, okay, and the physical
Yes.
component of you coming in, being sick, I give you a pill, and you
Yes.
go away.
Yes.
Okay, so we know that there's a direct relationship there, okay, and so on. So I'm not sure I understand why you have to do a test to show that, okay, and show that it's going to be cheaper and more effective when we already know that, and the reason why the doctors haven't been able to do it is that they don't get paid, okay, for seeing people in the office who, you know, somebody just died or somebody did this or they're under a lot of stress and so on and so forth, okay? So there is no stress counseling out there, which then leads to more disease, okay, and more illnesses. I mean, we've known that for a long time.
And so I think one of the things that was kind of I don't want to say a compromise, but definitely a piece of negotiation that happened with this budget, the governor was moving towards a path to do this across the state, to privatize everything across the state with the health plans. And what they've decided to do is look at a couple areas to pilot some different types of system work to create opportunities for integrated health. And so, yes, we all know those things, but to get those two systems to work together is very difficult, because payers don't always pay for both services. Payers maybe pay for a doctor to do a certain thing, but not for the therapist to do something related to the medical condition. And so forcing the two systems to create a pilot that might allow for some created braided funding, might open up some medical codes to the behavioral health side that don't currently exist, that we are unable to bill for on our side. That's what these pilots are going to look at.
All right, thank you.
So do we still qualify for the pilots, for any of them? Do you think we would fall under a rural county?
You know, Hillsdale may. I don't know if Jackson would qualify. You know, there was some talk about looking at an area with one health plan, for example, and in Jackson and Hillsdale, I believe both counties have 3 health plans now that work with them. The UP has 1. That may end up being the rural area, just, it is. And there's 1 health plan to work with on the medical side. So, but we have not heard them name it yet, as much as they've not named urban. Kent's the only one that's been named so far.
Thank you.
Anything else? Okay, Shannon, thank you.
Thank you.
Okay, we're going to move down to D now. Region 2 Area Agency on Aging 2018 Area Plan. And we have Margaret O'Malley.
I'm
Thanks
the
for being
third
here.
string today, I think. Everybody's busy. It's board week at our place. You had in your packets our 2018 area plan. You probably remember that we were here last year asking you to approve a 3-year plan, and that's the way this works. Every third year, we do the big plan for 3 years, and then in the next 2 years, we do an update on the plan, and that's what we're presenting to you today. An update on our goals and some of the different direct services that we're doing, and those updates are in your packet. So if you have questions, I'd be happy to answer them. We do all of those direct services that are in the plan: care management, information referral, the elder abuse, the evidence-based programs, nutrition and medication management. We operate all of those to some extent in all 3 counties that we serve. So you do get, Jackson does have benefit from those monies, in addition to the contracts that we award to Jackson directly.
Questions or comments for Margaret?
Just
Go ahead, John.
one comment more than anything, and that is, I don't ever remember seeing this on here before. I may have missed it, but I'd like to thank all of the people that have been business supporters for the Meals on Wheels program. I think that speaks a lot for the employers in the area.
Mm-hmm. Thank you.
Okay, well, obviously I've had an opportunity to look at it, Margaret, as you know, and
And you were at the public hearing.
yes, very good job with that. We have a statement on here that asks for us to approve this, so I'll be looking for a motion and support. Okay, all those in favor, so saying aye? Aye. Okay, thank you very much.
Thank you.
We're down to E, Department of Aging Monthly Report. Hey, Marcy.
Good afternoon. The Friends of Jackson Seniors donated $18,700 to the Department on Aging, and that was money raised at the Soups On for Seniors annual fundraising campaign, which culminated in the Soups On for Seniors event. And they donated the money at their last board meeting, and at Personnel and Finance, there's a request from Rick Shealy, the fleet director, requesting purchase of a van to replace one of our current meal delivery vans. And it does, the business supporters are included in information in my monthly report. Another thing I'm working on is with Jackson District Library. They received a grant for a program called Project Bridge, and it's services that support caregivers who are helping a family or friend who are helping someone who has memory difficulties, and different projects and programs that can be done with the caregiver and their loved one, as far as music and memory and reminiscence kits. Also, next year, they will have a program called Jackson District Library on the Road, and could be programs potentially for our senior nutrition sites. Different programs come in to present information and just interesting things, like a historian about World War II, or maybe some animals, unique animals for our senior sites, programs like that. And we have 2 new full-time staff. Our nutrition services manager is Linda Lee, and she oversees the senior nutrition site congregate meals, as well as our Meals on Wheels program. About 1,200 meals a day are prepared between home-delivered meals, Meals on Wheels, and our congregate senior sites. And then Lori Mead is our new enrichment specialist, and she oversees programs for Crouch Senior Center and also our other 7 nutrition sites in exercise classes, special speakers, coordinating all the craft and quilting, woodworking, that type of thing, classes. So and they're both on our aging leadership team. There's eight of us on the leadership team. And then Senior Citizen of the Year, that's with the Fair Board and the County Board of Commissioners. And the Advisory Council on Aging has selected 3 people to receive the Senior Citizen of the Year for 2017. And what's looked at is volunteer service since turning age 60. And there's details in the report, but the 3 recipients this year at Senior Day at the Fair will be Howard Griffiths, Barbara Martin, and Pauline O'Shea. And just a bit of information, if you've heard that Congress has tasked the Center for Medicare and Medicaid Services to take people's Social Security number off their Medicare card, that there'll be a different identifying number on people's Medicare card. And that will start in April, and they have until April of 2019 to change everyone's Medicare card. We're just hoping they keep it red, white, and blue because that's a key identifier for people to know what their Medicare card is that white paper with the blue stripe and the red stripe. So that'll be quite a task. But it's supposed to start in April.
Okay, Marcia, any questions or comments? Well, first of all, in regards to the Friends of Seniors and also to the Meals on Wheels, we talked about this earlier in Personnel and Finance. Truly appreciate everything. Certainly, the financial donations are wonderful, but certainly all the other work is exceptional. So, thank you very much. And these 3 people here, where the resolution that you have here, these are also 3 wonderful people. So, I appreciate you bringing this forward.
Yeah, great, thank you.
Okay, and I would like a motion support on these, please. Okay. All those in favor, signal by saying aye. Not, same signal. All right, thank you. All right, Marcy.
Okay. And the Senior of the Year awards will be given at 11 o'clock on Monday of the fair, August 7th, at the Herman Gumpert stage, if you happen to make it. And our Soups On for Seniors event for 2018 will be March 1st. That's a
Okay.
Thursday.
You working the fair again?
I'll be there
Oh.
on the 7th.
I always see you there. Okay, thank you.
All right, thanks.
Okay, Don, this is the Animal Shelter's second quarterly report.
Thank you very much, and I would like to wish you all a good afternoon. I certainly hope you had a great weekend. Weather was pretty cooperative, if I say so myself. Looking at your report, I am going to delay the first bullet point to the end of the report. I have our veterinarian, Dr. Anderson, coming in to perhaps answer a few key questions if you might have any. She is on her way. She has texted, got caught up in the construction traffic, Michigan Avenue, so she is imminently here. So with that, moving to the second bullet point, just wanted to inform you the volunteer program that we initially instituted in the past year or so started up again as far as the monthly orientation trainings. And that happened in June. Basically, we have an incremental process for our volunteers where we bring them in, orientation, trainings to start off with, and then as they spend more time at the shelter and start training a little bit more, become more involved and doing different things, incremental process. They get to a point where they will have a volunteer badge. At another point, they will actually get a T-shirt, and I believe we probably have a description of the T-shirt right there in red. And these three fine ladies are volunteers at the shelter, I might add, too. So we have Brenda, Cindy, and Cindy again? Nancy. Okay, I apologize for that. So anyways, they do a lot of good work. Brenda is the purveyor of the annual golf outing, which has bought us kennel gates, has bought us quite a few things from Friends of the Animals for the Jackson area. And then there's another golf outing this September coming up that doesn't just benefit the county animal shelter, but does a lot of good. And she's got that third annual? Fourth. And going great guns on that. So that kind of explains our volunteer orientation. You know, would we like to see more with our volunteers? Yes, because we have a lot of jobs, and we do have room for opportunity and growth, but it actually comes down to the ability to manage and structure the program. As you all know, we did another Bissell Empty the Shelters event on April 29th, and another huge success. We did move 54 dogs and cats out that day. Bissell Corporation out of Grand Rapids underwrites the adoption fees, so it's free to the public. We microchipped every animal that went out the door, and then the Bissell Corporation reimbursed us for the adoption fee. So it wasn't as much of a madhouse as it was in October. We didn't adopt as many animals out because we were not chock full. We were probably about 75% full at the time, versus in October we were probably running 95 to 100%. So a little bit of differences, but we learned some lessons from the October event, and it was definitely smoother, more manageable, and worked out quite well. And I'm very, very happy to tell you that our donated commercial level washer is actually fully operational. It's been a long time coming. I think I've mentioned it more than once through these monthly reports or quarterly reports. And it is fully functioning. It's a 50-pound capacity. It's what one of those big, huge ones you see in the commercial laundromats, and we are happy campers. The last log jam, if you will, in the laundry process has now been eliminated. So happy days are here again at the shelter. And just kind of looking at the back page for the statistical data, which provides quarterly and year-to-date data year over year as well. Some of the key highlights are that in the second quarter, we're 72 animals above 2016 levels. For the year, we're 54, so second quarter is kind of picking up the pace versus the first quarter. And we've had a slight increase in owner-requested euthanasias over 2016, an additional 31 animals, 155 versus 124. And owner-surrendered animals from the public have also increased over the 2016 year. Now, the key things, if you look at the data closely, two of the key things is, when it comes to euthanasia rates, one of the things we like to do is kind of take out the owner-requested euthanasias and then see what our actual euthanasia rate is due to health concerns or behavior concerns, or in the worst-case scenario during the summer months, euthanizing for space if need be. That's our last alternative, but for cats it still happens. We are over 2 years since we've had to do that for dogs. So if you look closely at number 5 and 6 at the bottom of the page, we've actually brought our dog euthanasia rate down slightly, 10.7 down to 10.1% as the numbers speak. And then, but significantly, for cat euthanasia, we got it down to 15.1%. There is kind of a semi-definition of what constitutes a no-kill shelter, if you will, but, and that's basically kind of hovering at the 10% level, because you're going to have health concerns, you're going to have behavior concerns, and if you can get down to that 10% level, you are definitely doing something right. And with that, I just want to say a lot of that credit, in fact, all the credit belongs to Dr. Anderson, as well as the staff that work at the shelter, as well as the volunteers that come in. So getting back to the number one bullet point, this is kind of one of the key things that we're moving forward with. Dr. Anderson, along with Attorney Brannigan with the prosecutor's office, have kind of started up a stakeholders informal group. The idea here is to coordinate the responses from the various human service agencies as well as police to make sure that everybody's in the loop, everybody's communicating with each other, and so that there's a good outcome. Because studies have shown that someone who's abusing, neglecting, or in other words, being cruel to an animal, oftentimes will do the same actions toward a human. So with that, I'm bringing up Dr. Anderson in case there are some questions. She definitely knows the gritty details of this group and kind of what the model is that they're patterning themselves after. Dr. Anderson?
Hi there, everybody. It's nice to see you. The Anti-Cruelty Task Force is something I'm very, very proud of. It is a coalition here within the county. The stakeholders are obviously the shelter, law enforcement, recruiting law enforcement into this, the prosecutor's office, Adult Protective Services, and Child Protective Services. Our goal is, of course, that we know that there is a link between animal abuse and human abuse. It's an internationally recognized phenomenon, and there's much work done on that. The program that we started is modeled after a few programs across the nation. It was something I have believed strongly in and have been lobbying for about 6 years. At this point, what we're trying to do is not only serve as a resource for law enforcement in terms of what to do in terms of prosecuting cases, but also to help with cases that do not raise to the level of prosecution but may need help that our first responders such as protective services are seeing. The model has been recognized across the nation. I am tonight finishing my master's degree in shelter medicine officially, and as one of my classes was a class on the link between interpersonal violence and animal abuse. In that class, I wrote a paper about the model that we have set up here. The instructor for that course is Philip Arkow, who is known across the international spectrum. He actually published the article that I wrote for the class in the April 2017 link. So that means that this program here in Jackson has already risen to recognition nationally and also internationally. We also were recognized for this program, which is fairly novel. At the regional level, we received word in it was about 10 days ago that we were being recognized at the Great Lakes Animal Welfare Conference for our bright idea, and we will be receiving a plaque. So again, I'm very proud of this program. I feel that it helps to fill some of the void with not having animal control officers. And so that's a brief summary. If anybody has any questions, I'm happy to answer them. I can stick around afterwards as well.
Comments or question? Dr. Tompkins?
For Don? For Don? Hi. How are things out at the animal shelter in regards to morale and people working together and overall management and so on?
Okay. Well, this is a tough time because spring through fall is what we know as cat season. It's busy as heck. There's a lot of stuff going on. We've had some turnover in the part-time positions, which puts additional stress upon the full-time staff as well. And this is actually a pretty good segue into my final topic. Last week, just to address some of these issues that you are alluding to, I did bring in a counselor, Jennifer Blau. I do this on a yearly basis. I brought her in a little earlier this year. She talked to the staff last week. I plan on bringing her in September period of time as a secondary beefing up or what have you. She is trained in compassion fatigue, which is similar to, has some of the same aspects as PTSD, because if you think about it, the folks who work in the shelter environment, in the shelter industry, they're doing it because they care about the animals. They want to do everything they can to save the animals. They want to do everything they can to find new homes. Yet at the same time, they are also having to euthanize animals, which is a complete contradiction of their stated goal by working at shelters and in the industry in general. So, and that's what we like to address. And I'm going to be clear. The shelter is understaffed, and when we're extremely busy, starting in April, May, and continuing into September, October, it puts a lot of stress onto the workforce. So, as a segue, I would actually like to talk and give everybody here a little heads up on what kind of started occurring about a month and a half ago or so that we noticed when it comes to the community service program, and how the shelter is actually staffed and how it's predicated upon the use of community service workers to get the job done. Do you have any other questions concerning your initial one? Okay. Well, with that, if I can take the liberty, I would like to just give you a heads up, a little FYI, because it is an issue, staffing at the shelter, that at some point the commissioners may have to make a decision at, somewhere down the road, a year down the road, 2 years down the road, what have you. But basically about a month and a half ago, we started seeing decreased levels of community service workers. Instead of the usual 3 to 6, 3 to 7 on a daily basis, we were getting down to 1 to 3 on a daily basis. Sometimes we would actually get the goose egg, 0 community service workers showing up. Now, when you only have 1 full-time attendant and 2 part-time attendants, 29 and a 20-hour, it's physically impossible to clean the shelter, with 2 people by 10 a.m. when we open for business, if you don't have additional manpower. And that's basically what was starting to occur a month and a half ago. Made some phone calls, didn't necessarily get exactly to the source of the problem, but what it came down to is apparently the court system has a grant through the state, and a component of the grant is concerning the community service program that is run within the court system that we rely on for our workers. And that component was not funded for the 2018 fiscal year, so it's kind of in the process of winding down. We were already starting to see the effects of that. It doesn't officially end till September 30th, but basically what we were finding is there were less community service workers to go around. The probation officers were not letting their probationers pay off their fines through community service, so the pool of community service workers was decreasing. And that's basically what I was able to find. Deborah was able to weave her way a little further into the court system and basically get to what the root of the problem is. And they are currently reworking the program and coming up with an alternative or a different management system for the thing. So with that being said, the community service worker program is not completely going away, but it may be restructured, it may be diminished. Time will tell exactly what is occurring there. So what's going on is that kind of gave us a heads up, because like I say, we're predicated upon community service workers. If we don't get community service workers, we're drastically understaffed and we can't get the job done in the morning and into the afternoon. There were times where I was actually mopping floors and cleaning kennels. Now, that's how bad it actually got, just to give you a heads up. So something you want to keep in your back pocket, something you need to recognize going down with time, okay? Because basically the problem with the model of using community service workers is, one, it's a highly variable quality of workforce, okay? It's continually moving in and out, so the 3 that are here today may not be here tomorrow or the next day, and then we have a new group, and everybody has to be trained to the task at hand for sanitary conditions, so there's always that time involvement with the staff. As I mentioned, it's impossible to get the place cleaned with 0 to 1 workers. And generally speaking, we're not noticed as far as workers not showing up until they don't show up. So that's just kind of the situation, and I wanted to bring it to your attention. And there's no action to take at this point in time, but it's something, food for thought, that we have to actually think about in the long term. In the meantime, Deborah's got a handle on the system. We have actually seen our number of community service workers get back close to approaching what was normal. Generally speaking, we're getting 2 or 3 a day, sometimes 4 or 5. In the good old days, it was generally speaking 3 or 4, sometimes 6 or 7. Okay, so just to kind of put things in perspective. And so that's, are there any questions with that? It's more of a heads up, FYI.
Of course.
Are there any programs at the Career Center where they could benefit from working at the shelter? Is there like a veterinary tech program out there or anything like that?
Well, actually, funny you should say that, the 20-hour person that I just hired about 2 weeks ago, she actually had some experience out at the Career Center as far as their agricultural sector. So she actually spent a good year or 2 working with the livestock and what have you, and was able to do vaccines and work with the livestock. And it's one of the reasons why I actually hired her compared to the other applicants that I had. There are some other, Deborah had mentioned a couple other programs. Sometimes the variability with some of these other programs is in the workforce is even greater than what we're, through the community service program. So, options are out there, but the quality is always a potential problem.
Administrator Overton.
I just want to take the opportunity to reiterate some of the things we've talked about with our budget. And you've heard me say it many times over the years. And this department is just one more example. When I say that, we've cut paper clips, we've cut supplies, we've cut and cut and cut for years. Before I got here, and I've been here 6 years, so we've been cutting for a good 8-10 years, easy. We're still probably 80 plus staff less than what we had total across the organization. And yet we find ourselves in the same position. We're still having, a $3 million hole we're trying to fill. We're at a point where we can't continue to, and I've said it many times, we can't cut into departments because they can't function. This department is one of those. Without volunteers, I don't know that we can even function out there. And again, we have a number of departments that are like that. I could argue easily, and I've said many times too that we're at a point where it's programming. What program are we not going to provide? Because you can't keep cutting your budget by millions and continue to the expectation of providing the same level of service. It's impossible. We end up being less than average at everything. And I, for one, don't want to be less than average at anything. And I'm sure that none of our staff and volunteers want to be in that position either. I know I met with Don and some folks last week to discuss this. And there's some significant challenges. The court has indicated that they're going to make some changes, and hopefully we'll see an uptick and some help out there. But at the same time, here we are. We're faced with working on our budget right now, as you know, trying to find ways to literally come up with $3 million, because if there's really not room on the revenue side, we're not going to grow our way out of it. I've said that many times as well. Not the way Proposal A and the Headley Amendment work in Michigan. So I don't want to preach to the choir, but this is just one more opportunity. I thought I'd throw it out there, especially since we're going to be talking significant and serious budget next month.
And I might add, you have been generous over the past few years when the ACOs left by providing me some money for casual employees. That can only go so far, and we're going to do what we have to do with our available resources. We are not going to not operate. There may be some extra frills that some of the public are getting used to that may have to go by the wayside. But it's a staffing model that maybe we should all look at and try to come up with some long-term solutions down the road. So,
Anything else?
Any other questions?
Okay. Well, Dr. Anderson, thank you for getting through the construction. Appreciate it. Your passion was pretty obvious when you got up there. Once again, mentioned friends earlier. Thanks again to other friends. Obviously, friends groups are very important to a lot of entities. And Don, I can't disagree with you. Obviously, the administrator and the commission understands the struggles that we have, and we'll do the best we can within the confines of what we have to work with. So, all right, thank you.
Thank you.
Okay, we're on to G. This is the Health Department Laboratory Services Agreement with Henry Ford Allegiance Health. Richard?
Good afternoon, all. The first item that we're discussing this afternoon is a kind of a completely reworked approach, if you will, to providing for laboratory services for the STD clinic at the Health Department. When Dr. Katayan was with us, he has departed for a one-year fellowship in occupational medicine, but promises to come back. But in the meantime, as he worked with us, we try to figure out a way of working through the complexity of different patient categories and insurance plans and uninsured, et cetera, if you will, to come up with a more logical way of getting people to the testing services that they need. And we figured out that the best way of doing that was to do it locally here with Henry Ford Allegiance Health as a partner, and this agreement basically addresses that need here in the community. It should really provide our client population with more efficient service and probably will actually reduce their out-of-pocket costs as well as some of the costs at the health department as well for arranging for and paying for testing services for STD infections in the community. So we've been able to work with the laboratory staff and the legal department over at Allegiance Health to put together a contract, if you will, that will do this. And we're seeking your support for moving this forward. It had an effective date of June 1st. I wouldn't worry about that. That's just the timing of everything that took place. So we're asking for your support to enter into this agreement with Henry Ford Allegiance Health.
Okay, Richard. John?
Richard, did we put this out for bid? Because we have other local labs here, like Garcia at Quest.
Yeah, actually, what we have in place right now is an agreement with Bronson for these same testing services, and we're going to be able to do them less expensively here. Last year, we actually looked at, when we renewed the agreement with Bronson, we looked at Garcia Labs, we looked at a number of other organizations who could provide services. In some cases, we didn't even get a response from them to our inquiry. So I think the fundamental answer to your question is yes, we did, but not an official, if you will, request for a quote perspective. We didn't do it quite that way. But we did do by phone calls and contacts that way.
Anything else? So, Richard, you put in here that there will be times that Bronson will still be used, isolated situations. So, so how long does that contract continue with them?
The contract with Bronson basically doesn't have there's no obligation for us to use them. We can terminate that contract at any time. But we thought it was okay to keep it in place in case we had a unique situation arise, or it would be better for a client to use Bronson than Henry Ford Allegiance Health. And
according to what you found out, you believe this is going to be more cost-effective and better for the public?
We do.
Okay. All right, unless there's anything further, I'll be looking for motion support to recommend the Board of Commissioners approve this laboratory service agreement with the HFAH effective June 1st, 2017.
So moved.
I can't support it. I want to see some official bids.
Okay. All right. I guess I concur with that. I would like to see the same thing. This motion dies. We will be looking at, if you could get, I guess we'll leave this up to the administrator and you to talk over, Mike, is that okay? If you would talk with Mike about this, Commissioner Plotkin actually has some really good points there, mentioning Garcia for one. I don't think we want to put ourselves in the position of people thinking that we're just not letting everybody have an opportunity, if you will. So,
Okay.
all right, Richard?
Yep, we'll go back and get the additional information.
Okay. Sure, that's all right, go ahead.
When you said that it's not going to cost more and so on, doesn't that all depend upon what our Senate does, okay, in regards to Medicaid funding and so on? Because if you lose half your Medicaid funding and so on, then you're going to have what we call a lot of no-pays, people who can't pay, and then it's going to cost you money.
Yeah, you are correct about that. If the Affordable Care Act and the Healthy Michigan Plan that is based on it go away, we're going to have less people that are covered by Medicaid, and if they're coming to see us at the health department for their needs, yes, there would be an inability, if you will, even for Henry Ford Legion's Health or any other laboratory for that matter, to bill Medicaid for reimbursement. And in that particular scenario, if we send a patient, say, even just using Henry Ford Legion's Health as an example, if we send them to the lab and they don't have coverage, they're considered in the uninsured category. And depending on their gender and their age, we can usually get a lot of free testing done through the Michigan Department of Health and Human Services. But for some specific categories of clients, if we send them to the laboratory locally here and they do run the test because it's needed to make a proper medical diagnosis and for treatment purposes, then if they're unable to bill Medicaid, they would bill the health department. But this agreement, the way it's written, has us reimbursing the laboratory at the Medicaid fee schedule rate. So there is a significant cost savings there over a commercial charge. But yes, it could increase the number of people that are uninsured and consequently more costs on the other side.
Okay, thank you. Let's move on then to H, and this will be your 2016 annual report.
The report this time around, we kind of changed it rather significantly. We wanted to go to more of a visual format, and that's what this report in Board Docs does for everyone today, including the board and the community as well. You may recall that our previous reports were considerably longer, had a lot more detail and content in them. We've switched, we keep doing that report, but it provides us with a lot of historical background information about each one of the individual programs that we provide services to the public and the community. And rather than make that the public, if you will, annual report, we decided to make something a lot easier to read, something much more visual in nature. So that's what this report is all about in the packet today. So it still has, obviously, the annual report cover page. We continue to maintain recognition of everybody that's involved in helping us deliver services to the community. Our vision continues at this point in time to be Michigan's healthiest community, and our mission statement has not changed at this point in time. But we did add a picture in so you can see who all the staff are that support doing the work in the community. And our highlights begin on this particular page here. So one of the things that we've been working on, and one of our public health nurses has actually been asked to co-present at the Michigan Public Health Premier Conference this year on the topic of HIV Data to Care program. So this is a new public health strategy that we initiated last year, and it aims to use HIV surveillance data to identify HIV diagnosed individuals that are not in care, link them to care, and support the HIV care continuum. So it's really important when people test positive to make sure they continue to get care and the treatment that will prevent transmitting the infection further. So it helps ensure improved health outcomes for individuals and reductions in new HIV infections. We dealt with a strawberry outbreak in the summer of 2016. It wasn't unique, obviously, to Michigan. It crossed 9 states, but there were more than 130 people affected and 52 were hospitalized. We had our CD nurses interview 8 potential human cases of hepatitis in Jackson County, all of which were negative for hepatitis A. And the EH division was actively involved in surveying 17 establishments that had potential receive strawberry product from the distributor. None were received locally here in Jackson County. So we closed that particular investigation out. I've tried to keep you as informed as possible, even in monthly reports about the state innovation model and where that is at, and we have a small snippet in the annual report there as well. We've been continuously participating in the local clinical and community linkages meetings of the SIM state information model. I'm in the information technology work group and a number of other ones. We had 2 meetings this morning. And Henry Ford Legion's Health serves as a fiduciary for funds from the grant that provides backbone support. So that continues to be a major activity here in the community and will be for the next 2 to 3 years. Accreditation, some highlights from our accreditation visit are contained on this particular page. We had our 6th state accreditation award in November of 2016. And accreditation does continue to strengthen the public health network through the state and local collaboration efforts. And we, again, are accredited as well for another 3 years. We will come up for reaccreditation in 2018. One of the other activities in the year was the Healthy Choices Pledge. We pledged to commit to providing at least 25% healthier foods and beverages that meet USDA nutrition standards. We do that in the health department, but we've also rolled it out to other organizations and departments in the county who have adopted it as well. So it does improve our ability to make healthy choices and make positive long-term changes to the community's health. The clinical reconfiguration project was completed in 2016, which really helped to improve workflow. And in addition to that, we freed up space at the WIC clinic, which has always been rather tightly constrained, if you will, with space to be able to use new space in the existing building as a result of this process. So we're pleased with being able to do that. Our clients' testimonials, there are 3 of them in the report for your information. One from a WIC client, one from the car seat safety program as well. It's nice to see people recognize how much some of these programs and services help them out. And one from an immunization WIC client as well. This person said that they love the convenience of being able to get my kids' shots done at the same time as my WIC appointment. We do a lot of cross-referral integrated services at the health department across the maternal and child health programs. So it works really well to have in place what we're doing all in one place. I always try to put something together on public health and healthcare integration. I spend a good amount of my time working on that stuff. And the one I've decided to kind of capture this time around is the Elevate lead test of children less than 6 years of age by Census Block Group. And just so you're aware as well that I did work with the City of Jackson to make an application for another $2.5 million HUD grant that is specifically focused on preventing or addressing the lead hazard controls in housing, if you will. And that was awarded to the city. The health department has a specific piece of that activity in the Healthy Home section, which was funded for $400,000. So we're continuing to work with partners in the community to do more to address lead-based paint and childhood lead poisoning. So overall, you know, the efforts that we're doing on integration really make us all stronger and results in more efficient and effective service use in the community. In personal and preventive health services, we had 261 MIP clients served last year, and 762 children were enrolled in the Special Healthcare Services Program, which supports families with children with individually specific complex medical needs, if you will. 314 children and families were served in the Early On Part C program. We do that with the Intermediate School District. We had unfortunately 10 infant deaths last year in 2016. We do have a team that reviews those and then makes reports back out to health action teams of the Health Improvement Organization Coordinating Council to try to change conditions in the community to prevent infant deaths in the first place. That's why we do it. 21 nursing-led case management home visits provided to families of children with elevated blood levels. That program changed a little bit in 2016. The state did decide that we could expand the number of home visits done from 2 to 6, and we're beginning to see more interest in that from the families that we currently have enrolled in the program. Prevention and action, we administered 5,600 doses of immunizations. We had 351 vaccine education sessions with local parents and guardians, and 901 flu vaccines were administered as well. Yes? They're part of the total, yes. Part of the 5,629. We had 1,494 individuals that were at access testing, treatment, or counseling through the STD clinic. We had 566 individuals received HIV screening and counseling, and we had 7 new HIV cases diagnosed in Jackson County, and that is actually less than it has been the previous 2 years, so we're pleased to see that coming back down again. We're still concerned about it. In communicable disease control, if you will, we had 2 new cases of TB occur in the community in 2016, and those, depending on the individual and depending on how many different contacts that they have, it can be a lot of work as far as a contact investigation is concerned. We always administer skin tests at the health department. We did 616 of those last year. We had 6 disease clusters or outbreaks investigated, 35 foodborne illness complaints investigated, and we had 61 animals tested for rabies and had 1 bat that was actually positive. It's usually a bat, almost always. Health education and health promotion. A lot of youth served through abstinence programming, which we continue to do at the health department. We have a teen outreach program as well, 146. We had 160 landlords, 322 community members received education on childhood lead poisoning and prevention. 20,000 kids enrolled on Medicaid here in Jackson County. Huge. 540 individuals assisted with the Medicaid application process, and there's some additional information on the car seat safety program down there in the right corner. The WIC program numbers are up in the right-hand corner there of this particular page. And I did previously mention that the WIC program brought over $2.8 million of revenue to Jackson County to the food vendors in 2016. And we do a lot of breastfeeding initiation work here with the WIC program clients. And you can see the numbers for hearing screening and vision screenings and referrals for failed screenings that take place. Lastly, environmental health is public health. The numbers of restaurant inspections that we've done are listed there on the left. 528 food service licenses issued. That number fluctuates a little bit with the number of what I at least perceive to be new restaurants opening up and operating in Jackson County. We probably have an increase. Don? I see Don's not here. But anyway, I think the number is up a little bit. 84 temporary food licenses, 99 food establishment-related complaints reviewed or investigated. And I would say that the sewage disposal permits probably are pretty level with what they were last year. And you can see the number of other kinds of permits and inspections that we do on an annual basis through the Environmental Health Division. Our 2 medical directors were and continue to be Dr. Amy Schultz. Cortland Catayan has transitioned, like I said, to a 1-year fellowship program. And Dr. Mike Faust is working with us now for the next 12 months. And on the emergency preparedness side of things, we continue to do the work that's necessary to receive those funds from CDC. And we did have a full-scale exercise in July of last year, and it was specifically related to making sure we understood how to access and dispense, if you will, pharmaceuticals that might come to us as a result of a public health emergency from the Strategic National Stockpile. So we're always training. The next page is our financials. Probably don't need to go into a lot of detail there. The last thing, one of the things that we did last year was to develop a cultural statement, if you will, for the health department. This was a staff-engaged competition, if you will, to develop a cultural statement that kind of visually represents what we are. And this is what one of our staff came up with, and everybody loved it. And we're a team. We respect each other. We have commitment and passion and go to infinity and beyond for clients. Our enthusiasm for public health is highly contagious. So hopefully you like that value statement. And that's our annual report for 16. Happy to answer any questions you might have.
Committee, questions regarding topic?
Of the 10 infant deaths, what was the cause of death?
Of the what? Of the infant deaths?
Yes.
Most of our infant deaths are either due to SIDS or they're due to poor safe sleep practices, meaning suffocation of the infant in a bed or on a couch, unfortunately, with parents co-sleeping.
Okay.
That's what we see here.
And next question is, what's the average cost of, say, per month of taking care of an HIV patient?
Well, if I would say it's probably running in the range of $10,000 to $12,000.
A month?
Yes. So it can easily run about $100,000 a year.
Okay.
So anything we can do to prevent more HIV cases in the community is going to save us as a society a lot of money.
Okay, thank you.
Yep.
Anything else? Okay, Minister Overton.
Richard, looking at your 2016 financials, your budget was, what, 6.68 million?
Right.
Approximately what percentage of that is funded through grant or reimbursements, grant?
I would say, well, I think federal and state, the revenue side down below at the bottom of that page is 88%. And we're looking at roughly 9% through fees and other revenue, and the county appropriation is at 3%.
I know. The reason I asked Richard that, because I wanted to drive that, make sure the board understood that, and anyone, as far as the viewing public goes as well. Because frequently people will say, well, you have these programs in the health department that really I don't think you should have. So cut that and you can save your $3 million deficit. The truth is, most of that money is grant money, federal and state and so forth. We could cut all our money out of the health department and nowhere near meet our deficit, but we would have a significant impact on our community. So it's not as easy as just looking at the large numbers and saying, oh, well, that department can afford, take $1 million out of that department. You really can't. We're very limited in what we can and can't do. It makes it very difficult for our budget, or at least when we're trying to reduce the budget. Thank you.
Anything else? Okay, you got your back up there now.
There's
Okay,
Don.
you go on to your health department monthly report now.
Sure. Thank you. Yes. Yes. Yes, we have, yeah, absolutely. Depending on which individual staff member, we would have any conversation about. I have staff that sometimes are coding into 5 different grant-funded programs. Not me so much, but I do have some other staff. Yeah. We become experts at integrating staff use across multiple grant-funded programs. It's pretty much the only way we can do things at this point in time. My monthly report is part of your packet in board docs, and just wanted to highlight a few things that I've identified. I have a few notes on. We did do an RFQ back in June of this year, early. Actually, the bidding process closed on June 2nd, and we did identify a couple of finalists that were selected for further investigation questions, potential negotiation and reference contracts. And really where we're at right now is we weren't able to move this process forward in such a way that we could get something to the board for review and approval, and also we missed an opportunity for some funding that we had available because we couldn't get this done in time for that. So it's kind of in a holding pattern right now. I just wanted you to know that we're still checking reference contacts, but we're also looking at the budget to figure out how can we come up with the initial one-time capital costs for this, and we're working with the HR director on it as well as how we fund it going into the out years. I think it would be of great benefit to us to have all of our learnings, if you will, in one place and be kind of basically effectively and administratively managed, and that's what this process is all about. And it supports our overall workforce development planning efforts that are part of national accreditation should we choose to go in that direction. Preserving the public health mental health system, I think you heard some earlier comments this afternoon about which direction that's going with our local state budget, Michigan, if you will. I just wanted to point out that the Michigan Association for Local Public Health, which we are a member of, is also very much aware of where this might go in the state budget in the next fiscal year. And the association passed a resolution in its June meeting encouraging preservation of the current public health mental health system in the state. And I include a copy of the resolution as an attachment for your information purposes. We are pretty actively involved in a number of different pilot projects and special projects, if you will, at the health department. This particular report seems to capture lots of those. We were approached because of our diligent work in childhood lead poisoning prevention by the state of Michigan through the Michigan Health Information Network to consider serving as kind of a pilot agency at the local level to receive information from the state laboratory in virtually real-time manner. Because we are a user of the local electronic medical record that the health system uses, and they will be transitioning to Epic next month, if you will, that we thought that they thought, and we did too, that we'd be an ideal candidate to test this. So what it means is that any laboratory specimens processed through the state laboratory or reported to the state laboratory, as they're required to be done by all providers who are testing for childhood lead, if you will, that are elevated would be reported back into the system almost virtually electronically at the same time. And we would be able to see those results basically the same day rather than necessarily having to wait a week, if you will, for a weekly spreadsheet to come from the Michigan Department of Health and Human Services telling us about elevated lead levels. So we thought that this was worth engaging in with them. It doesn't cost us anything to do it. And the Jackson Community Medical Record folks are on board with trying to set up the pilot as well.
Which computer system are they going to be on? The old NextGen or the new Epic?
Well, it's the HL7 messaging system with which actually both EMRs are capable of receiving information. So they're not going to implement it with NextGen. It'll be implemented with Epic. Yeah. So we think that's an interesting project for us to be involved in, and we have had that initial conference call with MyHIN and MDHHS staff as well as JCMR. We are an active pilot agency, if you will, in the social determinants of health screening pilot. We've agreed to be one of at least 4 local agencies who volunteer to participate in it. This is the social determinants of health screening that's been being implemented, if you will, through the state innovation model. So this is actually part of that model work. And we have one particular program in the health department that's best prepared to engage in this, and that would be our maternal and infant health program. So people enrolling in the MIP program basically would be screened for about 10 to 12 fundamental, basically, questions related to the social determinants of health. So when we talk about that, we're talking about housing, we're talking about employment, we're talking about income, whether there's interpersonal violence going on in the household, whether they have utility needs assistance, and so on and so forth. And so these are things that are outside the healthcare system as items to be managed, if you will, by healthcare providers. They're actually outside the public health system as well, but they have a great relationship to someone's individual health status. So the better job we do as a community of addressing them, the better off we're going to be in increasing people's health status. Opioid and prescription drug abuse grant opportunity, we worked with the County Prosecutor's Office, Prevention and Community Health at Henry Ford Legion's Health. I did copy you in board docs with the letter of interest that is related to this. And I think this is another kind of an example of how we really try to address the epidemic of opioid and prescription drug abuse locally here in Michigan in Jackson County by actually combining our efforts with the development of a crisis respite center that would be based or housed or operated, if you will, by Lifeway's Community Mental Health. So we're saying we want to do something more to reduce harm in the population that's actually having a problem with an addiction to opiates or heroin, if you will, by providing services within that same center. So we're not creating a new center, we're not creating new infrastructure, we're just dovetailing together with what's already being done. And there's a piece in that particular letter of interest as well for Henry Ford Health System and their providers through Jackson Health Network to get more specific information exchange going and to help providers, if you will, enter into what's referred to as an individual provider-patient contract when they're actually prescribing opiate prescriptions to people. So that's part of what we want to try to do. We'll learn by August 2nd if we've been invited to do a full proposal. Obviously, that's just around the corner, so I'll probably hear something next week, and we'll let you know what comes of that. Also, the next item in my board report related to that, you had asked last time, Commissioner Shotwell, for copies of the data collection committee minutes. Those are an attachment in the report. We had another meeting last Friday. It's going very well. We expect to have all that data pulled together in a meaningful way that conveys information for you and the community as well on what that problem looks like in the community. There's a lot of data available from law enforcement, the ambulance company, from public health sources, from the medical examiner, from Henry Ford Legion's Health ED. It's all coming together now, and I think you're going to be very well informed come the next summit meeting that takes place later this year. We also, another pilot that we're engaged in under health education, health promotion is actually a texting project with Hearing and Vision program. You may have picked up on the fact that we have hundreds, if you will, and maybe up to a few thousand children every year that are screened for hearing and vision in the school setting that actually are identified as having an abnormal outcome. When that occurs, what we do is we communicate directly with the parents through a first letter, then it will be followed by a second letter, and then finally a phone call encouraging them to have their child evaluated. It's unfortunate that sometimes we have a lot of children who don't get a follow-up screening test. They don't get in to see an optometrist or an audiologist, and we get very concerned about that because children who can't hear and see in school don't learn. So there's a very strong connection to those things. So what we did with the texting was said, okay, we're going to send one letter, then we're going to text people. And actually, you can see from my report, just having done 60 texts versus 60 letters saved us over $300 in postage, number one. And number two, we got a better response from parents to the texting than we even do when we send letters. So we're using information technology to the best of our ability here to get things done and to better support people's lifestyles and how they prefer to communicate. So we're very pleased with that. The abstinence program, we received an additional $10,000 in funds in that program through, I think, the end of probably September. And we launched a 4-week summer program titled Be Real for teens. This is different than Get Real, but it's an extension of the Get Real program. And the focus will be life skills along with college and career readiness for teens that are eligible for the Be Real program. One other project we were asked and approached by MDHHS to participate in is one involving trying to do some system change work for tobacco dependence treatment in dental clinics. We haven't done much with dental clinics in the past in terms of encouraging them to assess their clients' smoking status. Every dentist that you ever talk to, if you see them on a regular basis, will tell you the damaging effects of smoking from an oral health perspective. So it's not only the addiction process that we're trying to get to, it's also getting people to recognize how much damage is done to them in the oral cavity, if you will, with their teeth and gums. It's pretty devastating from a dentist perspective. So we have a total of 20,000 that'll be available beginning November 1st of this year. We decided to do a subcontract with the Michigan Primary Care Association because they've been doing this work across the state in probably half a dozen different locations. And it's relatively time-limited funding, so we said, well, we don't want to change our staffing and try to ramp up for just, relatively speaking, about 9 months. We'd rather see how this project goes, see if there's any more money available come next year, and then we'll reevaluate from there. So we will retain just $5,000 of the funds to support our administrative support and reporting requirements. The last thing in my report is that there is a survey that was done by Epic MRA concerning support for increasing the tobacco sale age. And the bottom line is that somewhere between 60 and 65% of people surveyed in the state of Michigan support raising the age to legally purchase tobacco to 21. It's another effort to try to do something more with tobacco use than what we probably have done in the past, and this is one of those policy-related initiatives. A package of 4 bills has now been introduced in the legislature that would specifically address various portions of various acts, if you will, that have something to do with the legal age to purchase tobacco. So a copy of that survey is in your board docs for information purposes. And that would pretty much constitute my report. I'm happy to answer any additional questions that you might have.
Okay, questions, comments? All right, Richard, thank you very much. Wealth of information.
You're welcome.
All right.
Thank you.
Okay, we have motion support for the claims for the full board. Okay, all those in favor, signal by saying aye. All right, thank you very much. Other minutes, we don't have any. And August reporting schedule, we have the Department of Aging, Health Department, and Lifeways. And we're down to number 6, public comment. Public comment. Okay, no public comment. Committee members' comments. No committee members, no committee member comments. We're down to being 1:17 p.m. and this is called at the request of the chair.